Welcome to King and Parsons Orthopedic Centers, where we are leaders in joint care. The following series of videos is our patient education guide to partial knee replacement surgery. First, we want to thank you for entrusting your care to us for your partial knee replacement. As a practice that specializes in joint replacement surgery, we've built a comprehensive program called Avatar that's designed to facilitate the recovery process and improve patient outcomes. We have a highly dedicated team of physicians, physician assistants, nurse practitioners, and office staff who are very tuned into our Avatar process, and our mission is our patient's end result. This manual is your Avatar partial knee replacement guide, and it's meant to help you prepare for surgery and maximize your recovery. If you have any questions that require further information, please contact us at any point in time at the phone number or email provided below. There is a lot of information in the following modules, and it's important that you take time to watch these videos or read the handouts so that you're fully prepared for your partial knee replacement and have a realistic understanding of what to expect. We've broken this material into several modules so that you can review these different aspects of the care episode at your own pace. It may be best to review this material more than once so that you can fully digest the information, and sometimes watching it with a family member or friend or caretaker can be helpful as well so that they can digest this information too. And you can refer back to these modules periodically as a resource for information as you go through the surgery and recovery process. Now we'll talk a little bit about knee anatomy. The knee consists of three different bones: the femur or thigh bone, the tibia or shin bone, and the patella or kneecap. In addition, as you can see from this picture, there are key tendons and ligaments that help to move and stabilize the knee during everyday activities. Knee arthritis occurs when the cartilage that forms the smooth gliding surface of the joint wears away and exposes the underlying bone, as you can see in this picture here. This results in pain, stiffness, and in severe cases, limb deformity. Arthritis is a progressive process that worsens with time, and as of now, there is no medical cure for arthritis. In some patients with knee arthritis, the disease is limited to just the inside part of the joint, leaving the other compartments of the knee without significant arthritis. And this is shown in the X-ray below, where the arthritis is isolated to the medial or inside part of the knee, where you can see there is narrowing of the joint space, and there is a normal joint space on the outside or lateral side of the knee, and a normal patellofemoral joint space between the kneecap and the femur bone. These pictures show the difference between a partial and a total knee replacement. As you can see in the left-hand picture, a partial knee replacement resurfaces only the worn medial compartment of the knee, leaving the lateral and the patellofemoral compartments intact. In comparison, a full knee replacement, as is shown on the right, resurfaces all three compartments of the knee. A successful partial knee replacement requires that certain criteria are met to ensure long-term success of the operation. And these include the following. The arthritis has to be limited to just the medial compartment with minimal involvement of the other compartments of the knee. There can be no history of rheumatoid arthritis or any other type of arthritis that is inflammatory or immune in nature, such as an autoimmune disease. The anterior cruciate ligament must be intact. There cannot be any significant loss of motion in either flexion or extension. And there needs to be adequate bone quality and no significant osteopenia or bone weakening that could lead to a stress fracture around the implant. Failure to meet all of these criteria can lead to premature implant failure or poor results that may require revision to a full knee replacement, and therefore patient selection for a partial knee replacement is critical. The following is a general guideline for when a knee replacement or partial knee replacement is appropriate to consider. First, the level of pain must be moderate to severe and significantly impair your activity level. When you find yourself avoiding certain activities that you would otherwise do because of pain, this is appropriate. When you have maximized conservative measures like medications, injection, exercise therapy, bracing, taping, supplements, etc., it can be appropriate. And finally, when your quality of life is sufficiently impaired to warrant surgery and recovery, you can consider knee replacement or partial knee replacement if you're an appropriate candidate. The tipping point is the point at which patients decide they no longer want to live with the pain and limitations of knee arthritis. And this point is different for everyone based on each individual's threshold for putting up with pain and restriction. Patients will often ask us, how do I know when it's time for surgery? And our response is generally, you'll know when you reach your tipping point. In appropriately selected patients who meet the optimal criteria for partial knee replacements, patients can enjoy excellent pain relief, range of motion, and stability. This chart goes over the potential pros and cons of each. Advantages of a partial knee replacement is that it's less invasive, it preserves more cartilage and bone, it leads to a more normal feeling knee, there are fewer early complications, there's a quicker recovery, and it's a relatively easy revision surgery if needed. The advantages of a total knee replacement include that it's a well-established procedure with long-term successful track record. It's a little bit less of a specialized procedure. There may be a better long-term survival rate past 15 years, and there can be no progression in arthritis in the compartments with remaining cartilage. Disadvantages of a partial knee replacement include that it's a specialized procedure that takes expertise. There may be a higher revision rate both early and late, and progression of arthritis in the other compartments is possible. Disadvantages of a full knee replacement include that it's a more invasive operation with a slower recovery, and there may be more long-term restrictions in activities. In terms of long-term expectations, knee replacements, including partial knee replacements, are very durable and generally permit patients to return to a high level of recreational activity. Biking, hiking, racket sports, skiing, and other sports are permitted, provided patients achieve the necessary level of strength and range to permit this. Repetitive impact activities such as distance running are generally discouraged, but some patients may choose to do this. And you should anticipate that should you desire to return to a very high level of recreational activity, you may continue to have occasional swelling or mild discomfort in the knee after strenuous use. And this typically will respond to general treatments such as ice or anti-inflammatory medications. When looking at the long-term durability of partial versus total knee replacement, in appropriately selected patients, a partial knee replacement can provide 15 to 20 years of durable function. Long-term follow-up data demonstrate that at 15 years, 90+% of total knee replacements are still functioning well, while only about 78% of partial knee replacements are still in place. So long-term, there is a drop-off rate in the survivorship of partial knee replacements compared to full knee replacements. And this implies that around 15 years after surgery, a higher percentage of patients with partial knee replacements may require revision surgery. And this is often because the other compartments of the joint will go on to start developing some arthritis. It may also occur because of loosening or wear of the implants.